Well, October is National Spine Health Awareness Month, a chance to highlight the importance of spine health and how spine-related issues can affect overall quality of life. Here with more is Dr. John Caridi with UT Health Neurosciences and Memorial Hermann. Welcome, doctor. We were just chatting during the commercial break and talking about how common back pain and back issues are. The lifetime incidence of low back pain, that's something that 3/4 of the population will experience at some point?
That's correct. Thank you so much for having me so we can bring some awareness to this. It's true. It is the second most common reason that people seek medical attention. People experience a severe pain that's debilitating, and they seek out medical advice. But the vast majority of the time, these are benign conditions which will resolve on their own. It's very uncommon that people need any kind of surgical intervention for treatment of their back problems. But there are many conditions that we do treat, but only when patients have really severe problems.
Okay, so I've heard a general rule of thumb that spinal surgery is sort of a last resort. When you mention that a lot of these issues can be resolved without surgery, what are we talking about here? I mean, diet, exercise, lifestyle choices. How can people avoid ending up in the hospital for back issues?
That's very accurate. Is the overall choices that people make every day can change the outcome of their spine health. And when we see patients with spine problems, many times we'll prescribe them a course of physical therapy to really strengthen their core and back musculature, which helps offload a lot of the discs and bones and allows the spine to heal itself. And also things like staying active and not spending a lot of time sitting in a chair, which is terrible for your spine. These are all things that we recommend for our patients, and those are the things that will keep people out of my office.
What are things, I think it's really cool too, that, I mean, you're in this business, you are a surgeon, but you want to keep people out of your office. I think that's awesome. Let's talk about when spine surgery is really warranted, because there are times when cases are so extreme that a person's health is actually at risk. And if left untreated, major problems could result.
That's absolutely correct. So one of the most common things we see at Memorial Hermann is trauma. So people who are in car accidents or falls or things like that, and they have fractures and, you know, their spine is unstable. That's a fairly common reason to need a spine surgery. People who have cancer that spread to their spine, that's also extremely, that's definitely a reason that you would end up needing surgery. But also people who have functional problems, not so much pain in the back, but for example, they have difficulty using their hand because their spinal cord or the nerves are compressed, or they have trouble moving their legs because they have so much compression in those areas from these diseases that are left untreated.
And Dr. Caridi, we have less than a minute left, but very quickly, if someone out there, I mean, let's say they're having a spine problem and they want to be sure that it doesn't get worse. Of course, they want to be sure they avoid having surgery in the future. What should they do to get on track?
So I think the first thing to do is reach out to your medical professional to make sure that this isn't a very serious problem, because a lot of things that we find are somewhat subtle in nature, and they could progress to things that are much worse. So see your doctor. A lot of times imaging is necessary, x-rays or MRIs, in order to verify that it's not a serious problem, and we'll lead you in the right direction. We'll get you to the physical therapist or to the pain management physicians who can get you onto the right track so that you don't end up needing an operation.
Well, and Dr. John Caridi, I'm sure that is welcome news for a lot of people, knowing that surgery is not always required. Dr. John Caridi, with UT Health Neurosciences and Memorial Hermann, thanks so much for your time today.
Thanks very much for having me.
And during the time of COVID, there's a great resource available. You can join Dr. John Caridi next Tuesday, October 19th from 6 to 7 p.m. for a free online webinar to learn more about spine health. For more info, you can visit memorialhermann.org/spine or call 713-704-7100.